MyCare Medical Group prides themselves on providing VIP care, and Dr. Jose Lebron Perez and Gigi Sanchez are back to explain the role of the primary care physician on cancer screenings. This is an interesting take. Welcome again back to the both of you. We're glad you're here. So yeah, I feel like if someone has to go get a cancer screening, they kind of move away from their primary care physician, but that doesn't necessarily have to be the case. What is the role of the primary care physician if you are facing cancer screenings?
We had a really important role. We're the first line. The patient go to our office yearly, every 6 months, every 3 months, and we got scheduled screening that we do to find everything early. If we're gonna find something, we want to do right on the spot, really early on the condition, so we can treat it and evaluate it properly. So we're the first line. We're the one who find it first.
And I like how you say too, those regular screenings that you're getting anyway, the regular appointments, I should say, how important those are. What about for patients that are over 50 or a little bit older? Do they need to see screenings more often, or what do they need to keep in mind?
We got regular screenings that we do. Essentially, we do breast cancer, cervical cancer, colon cancer, and lung cancer. In special conditions, depending on family history, on the patient history, we can do prostate or skin screening.
So, and again, I know some of those that you just kind of rattled off, those are the big ones that you hear, unfortunately, people get diagnosed with. What does some of these screenings involve, if you don't mind me asking?
We can do, in the case of lung cancer, we do CT scans, low-grade CT scans, so low dose, and patients who are smokers, currently smokers, or patients who have been quit smoking 15 years ago. Cervical cancer with the pap smear. We got breast cancer with the mammogram. Same way that we do colon cancer with colonoscopy, or even a kit that we do once a year, colonoscopy every 10 years, or sigmoidoscopy every 5. So we got different scales and different tests that we can do for those screening, and everything is laid out depending on the patient age, mainly about 50 to 75 years old. That's the age group that we have to do most of the screening.
And again, all of that stuff you kind of facilitate, right?
Yeah, we have the kids at the office. When the patient goes there, they can bring it back to the lab. And we got the referrals in case we have to send the patient for colonoscopy or special testing. But pretty much we do everything on the office when we got the scheduled visit. So we prepare the patient for doing everything, and it's easy. We find it quickly and we work on them right away.
I like too that you brought up the ease about it, because of course anytime you're thinking about cancer screenings, it's something no one wants to do and no one wants to face it. It's a possibility. So I love that you're making it easy. And I know one way too that you make it easy on patients is you also speak Spanish as well, which of course helps our bilingual patients, right?
Yes, that's true. A nuestros pacientes les decimos siempre que se hagan las pruebas de estreñimiento, que vayan a la oficina, vayan a su cita. Es bien importante que hagan sus pruebas para diagnosticar cáncer temprano, resolverlo temprano y poderlos ayudar en todo momento.
You know, Gigi, listen to him, of course, speak Spanish and talk to our Spanish-speaking viewers out there. That's got to be such a nice aspect for you to make sure people don't feel isolated if they necessarily don't speak the language. I know that's where you guys pride yourselves, right?
Sure. In MyCare Medical, we do believe in treating our patients as family. Not only our providers speak Spanish, but the office staff as well. So they feel at home when they go to their appointments. What we do pride ourselves as well is that we create a personalized health a plan for each one of the patients. So it's based on their individual needs. So now that we're talking about cancer screening, we look about their family history, so they trust us. They know that if they are our patient, they're going to be treated with that kind of level of care, so they can stay at home with their families. They don't have to spend the holidays in the hospital. They can be healthy, they can be happy, and they can make sure that we are taking care of them, you know, like part of the family that they are already.
I like that, like the VIP care.
The VIP care.
Well, again, for more information on anything that we just discussed, there's the information from MyCare Medical Group. To the both of you, thank you. I'm so glad you're part of the Morning Blend family.
Thank you.
Thank you very much.